Okay, go ahead.
Okay, great. All right, so I'm Dr. Weber. I'm going to go through dry eye and ocular surface disease this evening. About hopefully I can educate everybody a little bit about the very common term of dry eye disease and explain and go through in detail why it's not quite as easy as it sounds. And there are many types and therefore also lots of treatments. So I'm going to go through a presentation with everybody this evening. And certainly at the end, I'm happy to take any questions should they arise. So we'll get started. So just as a general outline for my presentation tonight, and just so everybody's aware, I don't have any financial disclosures. So all the drops and treatments that I talk about tonight, I don't have any incentive to push them in any way, but I'm just speaking from my experience with treating patients in a multiple different modalities. So today we're going to go through the definitions of dry eye disease, the symptoms, some risk factors for dry eye disease, how we diagnose and test for dry eye disease, some multitude of treatment options, and then how it relates to screen time, which is something everybody is doing a lot more of these days. I'll give some pointers about what we can do to be a little more mindful about our eye health, despite the amount of screen time that we all use. So let's get started. A couple definitions. So many patients don't realize that dry eye is actually used as a very broad term. It's an umbrella term that actually describes many different problems on the surface of the eye. Dry eye doesn't just mean you have a lack of tear film. There are many components to it, and the dry eye term is more of a kind of a broad ranging overarching term, but it's not very specific. And so patients can have lots of different symptoms and treatments that are all under the umbrella of dry eye. So it's multifactorial. There can be lots of risk factors. And for that reason, there are a large variety of treatments. It's extremely rare that we have patients that are on the same types of treatment for their type of dry eye because there's so many multiple predisposing factors that might be present. We try and customize treatments in a way that are going to be effective for your specific eyes. And that's likely going to be different than someone else that comes in for dry eye treatment as well. So it's important to know there are a large variety of treatments. We're going to go through those tonight. A couple other things to clear up. So dry eye doesn't always just mean physically the eyes are dry. It can also be related to a condition called blepharitis, which is an eyelid disease. We're going to talk about that in a moment. Dry eye can be the term that's also used in reference to something called Sjogren's syndrome, which is an autoimmune disease. Again, we're going to go into more detail with that throughout the presentation. And sometimes dry eye can be related to other medical issues in the rest of the body. And so it's important to know that the term dry eye just can have lots of different nuances to it depending on the specific patient. So what are we even talking about with dry eye? Again, because there's so many different reasons for having this term dry eye, it can present in many different ways. And so some patients will present and say, I have red eyes all the time, or I wake up and my eyes are red first thing in the morning, or when I take a shower, and the redness is what bothers me. They might have dry eye. It could be from other causes, but they could have dry eye. Another common symptom is stinging or burning. So patients that feel like the eyes are constantly having pain and irritation, burning, feeling like they can't get enough lubrication to keep the eyes wet, that's a common symptom, as well as blurry vision or vision that's fluctuating throughout the day. Sometimes sensitivity to light, so feeling like you step outside and the sun is really uncomfortable, or sometimes fluorescent lights can also trigger a lot of sensitivity to light. Occasionally, there can be a component of dry eye that's causing that. There can also be tearing, which many patients come in and find when I talk with them and examine their eyes, and they say, I have lots of tearing. I can't possibly have dry eyes. there's a connection to the tearing. Usually your eyes are naturally trying to make more tears themselves through lubrication. And sometimes the patient has no pain, but the only symptom they have is lots of tearing. That in and of itself can sometimes be a suggestion that there may be dry eye present that should be treated. Some other symptoms include foreign body sensation, itchiness, as well as eyelid positioning issues, all of which can be a tip-off that there might be some dryness or some component of ocular surface disease that needs to be evaluated. So what is the normal process? What should be happening in order for the eyes to be comfortable and have clear vision? So first, the tears are created from what's called the lacrimal gland. And that's denoted here by this big yellow gland. It's right under the brow and it's over by the outer edge. That gland is constantly secreting the water or the fluid component of your tears. And it's triggered to make more tears if you're blinking a lot. The blink will make it secrete more tears. That gland is also stimulated to make tears if you have irritation in the nose or in the sinuses. So that will trigger the formation of tears. And then things like eye rubbing and sometimes even emotional stimuli like feeling really upset can also trigger that gland to make more tears. So after the tears are secreted from the gland, they're on the surface of the eye. And over the course of a few seconds with normal blinking, the tears will move towards the nasal portion of the eye, the inner corner, at which point there are two small openings, one in the upper and one in the lower eyelid. And those openings connect to two small drains that then join in the back of the nose, and they drain the tears down the nose to an area in the sinuses that can connect to the back of the mouth as well. So in the normal course of about 20 to 30 seconds, your gland, the lacrimal gland, has made the tears. They've secreted onto the surface of the eye. They've blinked across and traveled over in towards the inner nose. And at that point, they've been directed down the drain to go into either the nose, the sinuses, or the back of the throat. And if there's problems anywhere from the start of the lacrimal gland to the surface of the eyes or the eyelids or to this drain, anything along this path can contribute to the symptoms of dry eye because it's altering the normal pathway of the tears, or perhaps the lacrimal gland is not even secreting enough tears. So there are multiple points along the pathway where things can get messed up or be out of balance. And that's how we try and direct our treatment when we examine your eyes in the office, because depending on whether we're treating the lacrimal gland or the eyelids or that drain in by the nose, they're all treated slightly differently. So it's important to make sure you have a thorough exam by an optometrist or an ophthalmologist to figure out where we need to start treatment so that you can be more comfortable. This is just another photo. It's the same idea, that lacrimal gland up top under the brow, secreting the tears. Things that we need for the eyes to be healthy and comfortable: normal eyelid position, normal blinking, good tear film, so making tears that will cross across the eye to that inner portion by the nose, and a normal corneal surface. That's the front layer of the eye. So if there's problems in any of those parts of the eye, you could be at risk for symptoms of dry eye. Of note, when we talk about the tear film, so that's the liquid that's on the front of the eye that lubricates the eye, it actually has three components. And depending on which part of the tear film is lacking or abnormal, we direct treatments to that as well. So the first component of the tear film is lipid. So that's actually like a fatty substance or an oil that gets secreted by glands that are around the eyelids and lashes. So there's oil glands that are lining the upper and lower eyelids. They secrete oil with every blink, and that prevents evaporation of the liquid tear from the eye. The second component is aqueous. So that's another word for water. And that's what's secreted by the lacrimal gland. So the water comes out of the lacrimal gland. It also contains a lot of healthy growth factors and some enzymes that can protect the eye against infection. And then the third component is a mucus type component that also comes from those eyelid glands and helps lubricate the surface of the eye. So you need all three to come together in the tear film, and normal blinking and normal production and normal extraction of the tears down through the nose to make the eye feel perfect and comfortable. So you can see it's a lot more complicated than just saying you don't have enough tears. There can be issues at any of these components that could be causing the symptoms. So we're going to go through kind of one by one. These are all things that patients can sometimes identify on their own at home, or maybe they're aware of because of their previous eye history as identifying factors that can make the dry eye worse. So number one, allergy. Patients that have seasonal allergies or eye allergies specifically, that can contribute to dry eye symptoms. Wearing contact lenses, while they're safe as long as they fit the eye properly and there's proper practice around hygiene, contact lenses are very safe, but in some patients they can worsen dry eye. Number three, having previous eye surgery. So patients that have undergone LASIK surgery or PRK or even cataract surgery, sometimes that can exacerbate or bring about symptoms of dryness. Number four, eye drops. While we use many eye drops for various reasons, sometimes drops that are treating glaucoma or retinal problems can actually have a side effect of creating dry eye. So whatever drops you're using, if they're a prescription eye drop, sometimes it's important to make sure your eye doctor is aware of what you're using because it could be making things worse in terms of the dryness. And then number five, blepharitis. So that's a condition. I've got a photo here listed on the PowerPoint, but it's a very common condition where there's inflammation of the eyelids that makes the eyelids look red, sometimes swollen or tender, and can create a lot of these crusts that accumulate all along the upper and the lower eyelids. Blepharitis is not the same as dry eye, but can have a lot of the same symptoms. And because it impacts the oil glands around the eye, it can then lead to problems of dryness down the line. Sometimes it's related to a bacterial infection, but not always. So blepharitis is an important thing to have your eye doctor take a look at and see if you have that issue, as well as, or perhaps in addition to, the dryness. There are also skin and dermatologic issues that can contribute to dry eye. So these are things that impact the eyelids, which are very important for the process of making tears and being sure the eye is comfortable. So having skin issues like rosacea, eczema, and psoriasis all can sometimes have crossover around the eyelids, contributing to dry eye. Things like eyelash extensions, as well as eye makeup, eyeliner, mascara, all of those things that are applied around the eyelids and lashes can all have a tendency to exacerbate dry eye, as well as eyelid malposition. So in the photo, you can see a droopy lower eyelid will cause a lot of issues with the tear film because the eyelid isn't blinking normally as it should. Or sometimes eyelids that don't close all the way when you're sleeping can sometimes trigger dryness as well. There are also medical issues that affect the rest of the body that can manifest or be associated with dry eye symptoms. So one of the most common conditions associated with dry eye is an autoimmune condition called Sjogren's disease. The condition itself is not that common, but it's known because of its connection to dry eye and dry mouth, that it can be tested usually through a series of blood work studies, as well as sometimes biopsies. And a rheumatologist can be helpful if you're suspicious of having an autoimmune condition such as Sjogren's disease to help with further treatments. Other medical connections to dry eye include thyroid issues. So if you're on thyroid medication, sometimes that can predispose to dry eye. Having Parkinson's disease, which interestingly causes you to blink less often, that can contribute to dry eye disease. Patients that are undergoing chemotherapy or radiation can also have a lot of dryness on the front of the eyes, as well as aging. So over time, dry eye tends to be associated with patients that get older, but there are plenty of patients in their 20s, 30s, and 40s that can have dryness too. So aging isn't the only risk factor, but we do know that as patients tend to get older, the dryness tends to be more frequent. And then the last thing is hormonal issues. So having imbalance between hormones in the rest of the body, for instance, around the time of menopause, that can also contribute to dry eye disease as well. So hopefully when you're getting an eye exam, your eye doctor should be asking you about your medical history to see and identify if any of these conditions are present, because sometimes our treatments may revolve around talking with the patient's primary care doctor to see if we can limit risks from other medical conditions in the body. There are a multitude of environmental issues, and I think this is probably what most patients think of when they think of having dry, irritated eyes. Commonly being in a smoky environment or an area with poor air quality, like smog or even after the wildfires, for example, having actual allergens and debris in the environment and the air that you're breathing in is also impacting the surface of the eyes. And so trying to limit how much of a poor air quality environment you're in when you're indoors can be really helpful at limiting your symptoms. Allergens in general, so seasonal allergies, having things like pollen and ragweed in the air can also worsen dry eye. So some patients will have worsening symptoms in the springtime or in the fall when the seasons are changing, and usually that's triggered by environmental allergens. There can also be issues with the environment you're in when you're indoors. So things like ceiling fans, or if you have a vent of air, like either in the car or in the ceiling that's directed down onto your face and onto your eyes, that can cause dryness as well. Environments that have really dehumidified or dry air, airplanes tend to be a common location where the eyes just feel very uncomfortable while you're on a long flight, and it's because of the air circulation that's going through on the airplane. So the environmental issues, usually we will try and have patients make modifications either at home or in their workplace to try and limit how much of this is contributing to their symptoms. So how do we know if you even have dry eye or ocular surface disease? A lot of patients know that they might have something going on because they feel the symptoms of dry eye, but the true diagnosis usually comes from an eye exam, whether that's from your optometrist or an ophthalmologist. They will do a number of tests in the office, including checking your vision. They're going to check the front surface of the eyes, including your eyelids, the oil glands, how much tears you're making. And they may do some additional testing, including specialty photographs, something called a Schirmer's test, as well as blood work to evaluate and see if anything else in the rest of the body is pointing to you having dry eye or ocular surface problems. So once you've been diagnosed, the next question patients always ask is, what can I do about it? How can I feel better? We're going to go through a number of different treatment strategies, a lot of which you can start on your own without the need for any prescription, that can already make small improvements in your day-to-day routine. So there's a couple things listed here, including compresses, lubricant drops, sunglasses, cleaning the eyes, using a humidifier, staying hydrated. But we're going to go through all these things kind of one chunk at a time, so the patients, you guys, of course, can get an idea of what are some easy solutions I can do right now that might make my eyes feel better? All right, so again, first thing we're going to think about is where are you spending most of your time when you have your symptoms? A lot of patients are working from home, or if they are going into the office, they may be in an environment where there's things they can modify, like the lighting, the temperature, the vents where they work, the setup of their screen, and whatever they might be working on at their workspace. So, a couple things that you can do right away is look around where you're working, where you're spending most of your time, and see if there's any vents directed onto the eyes. That's one of the easiest, quickest things you can do. For instance, in the car, if you drive a lot, and you have the vents directed up towards the eyes, whether it's hot air or cold air, the movement of the air directed towards the eyes will tend to dry out the eyes quicker. So the first thing you can do is just turn the vents up towards the ceiling or push them down towards your feet. Just move them away from the eye and the face location. So same in the workplace, if you've got a vent overhead, see if you can have it directed in a different direction from your eyes so that you feel more comfortable. On the same note, we usually recommend minimizing the use of ceiling fans for the same reason. It's dry air circulating that can be pushed down and cause the eyes to dry out quicker. You can also try to increase the humidity of your environment locally. So many patients will advise them to get a humidifier to put in the bedroom and turn that on when they're sleeping to make the air more humid, which means more moist, and that will make the eyes feel more comfortable. In your workspace, you can also use a small portable humidifier, which can be helpful as well. You want to avoid any dry and arid conditions as much as possible. So places like the Southwest or in desert locations or in really, really hot locations that are sandy, all of those things can exacerbate dryness. So trying to limit that as much as you can will be beneficial. And then there are a lot of kind of lifestyle things you can change about your workspace as well. So the screen time, we're going to talk about that a little bit more at the end of the presentation, but taking frequent breaks from screens is extremely helpful. We are all using screens a lot more than ever before, especially with everything moving to a virtual or to a electronic or digital workspace. Using screens can definitely cause dry eye and eye strain. So taking frequent breaks from the screens can be very helpful. There's something called the 20-20-20 rule. And this is a rule that's encouraged by the American Academy of Ophthalmology for minimizing and treating dry eye. So what that means is every 20 minutes, you want to look at something that's at least 20 feet away. So usually I tell patients look out the window or look down a hallway. You want to look at a distance target for at least 20 seconds. So take a break from your computer, look at something far, far away for at least 20 seconds. Let your eyes defocus and take a break. And you want to do that about 2 to 3 times an hour to avoid eye strain and dryness. Some other things you can do, frequent blinking. So patients often figure this out themselves. They say, oh, my eyes are really dry. I want to rub them and blink a lot. That's creating more tears. You're trying to trigger that pathway of creating more tears, which is helpful. I would say avoid eye rubbing because that can have some other problems with the eye. But even just sitting at your computer screen and consciously deciding to blink a couple of extra times within a minute or two can be very helpful. And then limiting contact lens wear, especially if you do a lot of screen work, wearing the contact lenses can sometimes dry the eyes. Plus, looking at a computer screen for a long time, those two things combined tend to dry the eyes significantly. So if you're on a computer for a long period of time, consider wearing glasses instead of contact lenses. Another option for keeping your work environment comfortable is putting the screen just slightly below your eye level. And that's important so that you're not looking up with your chin constantly, looking at a screen that's too high. That can cause a lot of neck problems and usually can contribute to strain as well of the eyes. Not so much the dryness issue, but it can create a lot of heaviness and strain. And so making sure your screen is positioned either at eye level or even just slightly below can be more comfortable. Many patients come in asking about blue blocking glasses. They have been around for a few years now, more popular in the last 2 to 3 years, especially with the pandemic, because everyone was using screens more often, and that's when they started to become more popular. So, blue blocking glasses are essentially a filter that goes on your glasses or can be incorporated into the computer screen you're working on through some settings on your computer. And blue blocking glasses are trying to minimize how much of the blue light from the screen is coming into your eyes. Now, from a dryness standpoint, the blue blocking glasses don't really limit dryness. You still need to blink a lot, you still need to take frequent breaks. But by limiting the amount of blue light, sometimes patients say it makes them sleep easier, it makes their eyes more comfortable and less strained, and sometimes it can limit headaches. So the blue blocking glasses can be helpful for some reasons with screen time. They're not 100% in terms of limiting dryness or limiting eye blurriness, because the blue blocking can only do so much. It's not effective again for dryness. It's more for eye strain and sometimes fixing sleep and headache issues. But it's something patients will often try as an alternative. And in some patients, they feel that it makes benefit. Other patients say it doesn't really make a big difference. So in all the research studies, in terms of dry eye, the blue blocking glasses are not effective for limiting dryness. But again, for those other reasons, they might be worth a try just to see if they give you a benefit. Treatment options that are directed at the eyelids include trying to improve how much of that oil or fatty substance is secreted from the glands. Because the more we get the oil to come out of the glands, then the less likely the tears your eye is making will be evaporating. And the longer they stay on the surface of the eye, the better. So you can do on a regular basis, just at home, you can get a washcloth, put it under warm water. You can apply Johnson & Johnson baby shampoo, just a bottle from over the counter at the pharmacy. And with the eyes closed, you can do some gentle eyelid and eyelash cleaning horizontally. None of the scrubbing or the baby shampoo is going to go in the eye. You want to do it with your eyes closed, externally cleaning the surface. And even doing that once a day can be very helpful at getting the oil to come out of the glands and removing any crusting from your eyelids. There are some prescription options, including Avenova, which I have a picture of here. But there are some over-the-counter options as well, including the brand called OcuSoft. They make a foaming eye cleanser that can be very helpful, as well as hypochlorous acid spray, which sounds concerning, but this component, hypochlorous acid, is actually very safe to use on the skin and the eyelids and can be really effective at removing a lot of that crusting. Sometimes if there's an eyelid position issue, either it's droopy or it's drooping down on the bottom, those are things with the eyelids that usually cleaning and sprays and wipes cannot fix. And so you may be referred to an oculoplastic surgeon if those issues are present. Some other options include something called a brooder mask or a heat mask. This is something you can buy online through Amazon. The company Brooder is excellent. They're very reputable. They make masks that you can put in the microwave for a minute or two at a time. They will hold heat, and then you can apply it over your eyes, and it will give those oil glands heated compression for about 3 to 5 minutes, which can be very helpful at getting the oil to come out of those glands. Many patients will use the Brooder mask once a day or a few times a week and notice that it gives them a better quality of tear film and less symptoms of dry eye. There are some treatments in the office, including something called LipiFlow or iLux. There's also something called IPL. These are actually little devices that are administered on the eyelid when you're in the office. And they do the same thing as the heat mask. They're putting heat gently on the eyelids on those oil glands. usually for about 5 to 10 minutes in the office, and then the device is removed and the doctor will usually do a massage treatment or sometimes a drainage treatment to help get the oil from those oil glands. So those are things you can talk with your eye provider about. Those are in-office treatments. And then the last thing, you can also look online. There are humidity chamber goggles. So this is actually a full goggle you wear over the eyes when you sleep that increases the amount of moisture around the eyes and can help limit dryness. So that's something a little bit more involved. It can be a bit expensive. So usually we would recommend you see an ophthalmologist or an optometrist who can give you the brand names to get that type of goggle. Many patients already know about this option, but there are lots of over-the-counter eye drops that can be very helpful for treating dry eye. I've listed a couple brand names here. These are the most common: Refresh, Sustain, TheraTears, Oasis Tears. These are all excellent and reputable, safe eye drops. I will caution people that are on the Zoom, there was a recall of lubricant drops last fall for some generic versions of eye drops. So some of the Target and CVS branded lubricant drops that were generic versions ended up being recalled out of concern for a possible risk of infection. So I usually tell patients when it comes to the lubricants, I would stick with the brand names. So again, I've listed them here, the most common: Refresh, Sustain, TheraTears, and Oasis Tears. You can even use a preservative-free version, which can give more comfort on eyes that are already irritated. The preservative-free lubricants come in these small individual vials. Once they're open, they usually have about 8 to 10 drops. You can administer them throughout the day, but you shouldn't use those drops beyond 24 hours. Once it's open, you should not use those drops the following day. You should open a fresh vial each time. There are also some over-the-counter lubricant gels. So they come in a tube. They're a bit thicker. The lubricant gels, because it's more viscous, it's almost like a Vaseline type substance that's safe for the eye. It does tend to blur the vision. So for patients that are using a lubricant gel, we don't advise using it during the daytime. Instead, you should put it in the eyes right before you go to bed. And that way, if it causes blurriness, your eyes are closed when you're sleeping, and so usually it's less of an issue. There are some eyelid procedures. So again, this is targeting that pathway of where the tears go down through those little tiny canals to connect to the nose. So there are some in-office options, including something called a punctal plug. So there are a few versions, but essentially it's a small little device that will block off either the upper or the lower drain, and can be temporary, can be more permanent. But the goal here is to try and slow the flow of the tears from the surface of the eye from going down the drain into the nose. So if you can slow that flow, the tears that you're naturally making will stay on the surface of the eye longer and will give patients more relief. There are also, if there's an allergy component to the dryness and the irritation on the eyes, there are lots of over-the-counter options. I've listed quite a few here. I usually recommend the Pataday, the once daily relief version. This is the extra strength. It has a green package or a green label. This is a very effective allergy eye drop that can be used once daily in the morning. So if patients are specifically noticing lots of itching and redness, the Pataday tends to be very helpful and is safe to be used once a day long term, or whenever the seasonal allergies hit. It's important to know a lot of patients take, over-the-counter oral medications for allergy, like Claritin or Zyrtec. Those can be helpful, but Benadryl specifically tends to make dry eye worse. So we usually recommend avoiding Benadryl if you're using it for allergy symptoms and you have dry eye. And nasal sprays, which can be very helpful at limiting nasal congestion, unfortunately also tend to worsen eye dryness. And so if you're using a lot of nasal spray and you're complaining and noticing that the eyes are burning and irritated and blurry, sometimes it's the nasal spray that's causing the issue, not necessarily the allergy. So those are all things that are important to tell your eye doctor when you go in for an exam including over-the-counter things like nasal spray or Zyrtec or Claritin. And then finally, of course, there are prescription medications. These do require a prescription from a physician. And these options usually are employed if all of the previous treatments we've just discussed or whatever was necessary hasn't been enough to control the symptoms. So prescription eye drops can sometimes include steroid eye drops. They can include prescriptions. Many patients have heard of the names like Restasis or Xiidra or Cequa. There are also some specialty drops that can be compounded from specific special pharmacies, not the CVS or the Walgreens, but they come from specially made pharmacies and can be helpful for treating dry eye, as well as something called serum tears, which are eye drops that are actually made out of some of the components in the patient's bloodstream. So they actually go and get a blood draw, and there's certain growth factors that are extracted from the patient's blood and then mixed with a lubricant that can be very effective for treating dry eye as well. So all of these options are usually when the dryness is a little bit more advanced or just hasn't responded to the other treatments that have, that are targeted at the lubrication and the oil glands and so forth. And then the last thing, again, this is more severe cases, but sometimes we'll recommend putting in a special type of a contact lens or a scleral lens, or perhaps even eyelid surgery in a really, in a fashion that would be usually only used if, again, the previous treatments as well as the prescription drops didn't work. So usually if we're talking about these types of options, these are patients that have been followed in the office, undergone multiple treatments, and still are not getting quite the improvement in symptoms that they want. So just briefly, kind of to close things down and summarize, we'll also just go through briefly about some other tips and tricks that you can consider for limiting dryness that's related to screen time. So again, the whole issue is that when you're on the screen, you're not blinking as much, and not blinking as much tends to make the dryness worse. Prolonged screen time can also cause redness or eye strain or headaches. So again, taking frequent breaks from the screens, making sure you're looking 20 feet away for 20 seconds at a time every 20 minutes is going to help make the eyes feel more comfortable. You can also use lubricant drops when you're doing your screen work. So often I'll tell patients, or the same as if they're going to be watching television for a while, I'll say, put in a lubricant before you start, and that will help coat the eyes so you feel more comfortable as you're doing whatever activity you're working on the tablet, on the television, or on the computer. You want to make sure you have adequate lighting. So in this photo, for instance, this person is doing computer work and in the dark. You really don't want to do that. It's also going to put more strain on the eyes than necessary. So having enough ambient lighting to get your work done so you're not straining can be helpful. And again, we had mentioned briefly considering the blue blocking glasses if you're interested. I usually tell patients don't spend a lot of money on that option. They tend to be a little bit more pricey, and they don't always give patients the benefit that they expect. So I would try a cheap alternative and see if it helps. And if it doesn't, then I would otherwise stick with the other options that we've discussed. And then one last thing that I just thought was interesting. This actually came about and was identified as COVID was taking place and everyone started wearing masks. It's still pertinent today because we're still wearing masks commonly in crowded spaces or in doctors' offices. And interestingly, when you're wearing a mask, of course, it's helpful for the spread of disease and avoiding, any kind of spread that can come from a runny nose or a sneeze or even from the mouth. Anything like that is protected by the mask. But interestingly, a lot of the air that you breathe out of your mouth and your nose when you're wearing a mask can go upwards and then be almost like a current of air that goes across the eyes. And so one thing, if you're wearing a mask for prolonged periods, you probably want to take a break or use a lubricant drop to help minimize any dryness that can come from wearing the mask. So I just thought that was an interesting connection, especially timely with the world that we live in. So while the wearing of the mask is extremely important, for protecting you and protecting others, it is important just to be aware that it can make dry eye symptoms a little bit worse. So either use a lubricant or take breaks in a protected way so that you can remove the mask. So just to close, hopefully this was a beneficial overview about dry eye disease, ocular surface disease. Remember, if you are noticing any of those symptoms that we had discussed at the beginning of the presentation, whether that's burning and pain, blurry vision, dryness, redness, feeling like a foreign body sensation on the eye, having eyelid crusting, all of those things can be related to dry eye. And the most important thing for you to do is have an evaluation by an eye care provider so that they can determine your diagnosis and then talk about all these varieties of treatment options and specifically which ones will be helpful for you. So that concludes my portion of the talk. I'm happy to take questions either through the chat or through the Q&A. Sean, I'll have you kind of assist with
Sure.
going through that, and we can do a couple minutes for questions.
All right, Dr. Weber, thank you so much for a great presentation. For those of you who maybe joined a little bit later, we are recording this, so you will be able to access it later this week. Now, to ask your questions, there is a Q&A box, but you can also raise your hand, and when you raise your hand, I'll give you the ability to speak on the webinar. So I'm going to start with Mark W. You just need to unmute yourself. And to unmute yourself, there's a button at the bottom left of your screen. You can also do Alt plus the letter A. All right, we'll get back to you, Mark. We have Michael H. I'm going to give you permission to speak. You just need to take yourself off mute.
Okay, hopefully you can hear me.
Yes, go right ahead.
Yep.
Thank you.
Okay, thanks, Dr. Weber.
Yeah.
I use that Bruder mask right now,
Mhm.
like it, and I thought it provides some kind of moistening too. And
Mhm.
when I take it off, I thought I was told, go ahead and just gently rub your eyelids because any of the oils, that maybe got loosened up, you can help get those off. And when I
Uh-oh.
Michael,
Michael, we
we
just
heard you for
lost
the
you.
first half. Yeah.
Yep.
Oh, okay.
There we go.
Something happened there. Okay, I don't know.
That's okay.
No
We hear
problem.
you now.
Okay, so I said I used the mask when, and I think it was supposed to moisten the eyes also.
Mhm.
And when I take it off, I was told, rub the eyelids gently because some of that oil that got loosened up there, that'll be good. And I'll feel though like some water or moisture like coming out then of my eyes too when I do that. Is that not a good thing? Should I not then rub the eyelid? Do I want to keep that moisture in there, or is that okay?
Yeah, so it's actually perfectly fine. In fact, whether you're using the heat mask like the Brooder, which is excellent, or a warm compress from a washcloth, I usually will say keep it on for 3 to 5 minutes. And then when it's finished, you can take it off with clean hands or a clean tissue. You can gently massage the eyelids for exactly that purpose to get some of the blocked oil out of the glands. And it's common that you might feel some wetness or a little bit of fluid, and that's okay. That's a good thing. That usually means you're getting things moving. And so that's the benefit of the heat mask. So that's perfectly fine to continue doing. That's great.
Great, thank you.
You're welcome.
All right, and we do have a couple questions here in the Q&A.
Yeah.
So I think the first question is, are there any of the treatments for dry eye contraindicated if the patient has glaucoma, macular degeneration, or cataracts?
So that's a great question because there's obviously more things that can happen to the eye besides just dryness. Things like glaucoma and macular degeneration, and even cataract surgery and undergoing that process can all contribute to other symptoms and issues in the eye. I'll actually reframe it the other way. Some of the treatments for glaucoma, like eye drops, um, even some treatments for retinal issues, including injections, sometimes they can make dry eye worse. So it can be really important if you are having a lot of burning and irritation, and you follow with a glaucoma or a retina specialist to let them know, because sometimes they can change or alter their treatments in a way that might make the eyes more comfortable. But usually dry eye treatments, including the lubricants and the eyelid cleaning, are very safe to do even if you have glaucoma or macular degeneration. The only thing I would caution is patients that are on prescription eye drops for dry eye, so either the steroids or sometimes the serum tears or the Restasis or the Xiidra. Prescription eye drops for dry eye can sometimes have impacts on glaucoma, specifically related to eye pressure. So again, that's one more reason you just want to be sure that your ophthalmologist or optometrist knows all the medications you're taking for all the issues in your eye to make sure that there's not going to be crossover that makes anything worse. That's a great question.
All right, thank you. So we do have a couple other questions. So one, these two questions kind of come together. One is, can you use dry eye drops just because you want to if you're in an environment that promotes dry eye? So I guess the question is it preventative, and are there any negative outcomes that could happen with drops over the counter?
Yeah. So again, as long as you're using a safe lubricant, so again, I would recommend a brand name version. Sometimes that's preservative free. It doesn't always have to be, but as long as you're using a brand lubricant drop, there really should be no side effects from it unless you have specific other eye issues. So actually, this is related to the other question. Just briefly, I'll just mention because somebody asked here the difference between BAC versus oxy preservatives. So both of those are related to the type of chemical that preserves the eye drop. There's a difference just in the chemical compound between those two preservatives, but the short answer is either of those can cause irritation on the eye. Doesn't happen to everybody, but it can happen. So usually the safest option for just picking up a lubricant off the shelf that you want to put in when you need it, if you're on the computer or you're in a dry area, usually we recommend a preservative-free version of a lubricant. That's the least likely to have any other impact on your eye in a negative way. Interestingly, again, so John wrote this in the chat as well. You're right, the preservative-free lubricants, they commonly come in these little individual plastic vials. And the purpose for that is so that that way each vial has enough lubricant in it with no preservatives. There won't be any extra toxicity risk for eye irritation. And the purpose is so that you can open the vial and you have a completely sterile, safe lubricant with no preservatives that won't irritate the eye. The problem is those little individual plastic vials are not good for the environment because usually patients buy them in a box of about 30 to 60. And again, if they're only used for 24 hours and patients are using them day in and day out, you're right, it absolutely is not a good long-term solution for our environment if we're accumulating all this extra plastic debris. So interestingly, there is a new, I'm just going to look real quick. There are a couple brands that are trying to work on that so that you don't have the little individual vials. I don't have one with me, but I'll just show you. So Refresh is a common lubricant drop. Not this bottle specifically, but Refresh and Sustain are both coming out with bottles that have what's called a one-way or a check valve in the top. So when you administer the drop, the eye drop can't get sucked back into the bottle in any way, and so therefore infection can't go back in. The bottles that have this one-way valve specifically are preservative-free and then limit the need for those plastic vials and the accumulation of plastic debris. So we're working towards a more environmentally healthy and happy solution. But right now we're still in the midst of having preservative-free drops that have lots of those individual plastic vials or these newer bottles that are coming out with a one-way valve. How do you know if the bottle of drops you have has the valve or not? You have to see the words preservative free. If it doesn't say preservative free, then there might be chemicals like BAC and some other things that are preserving that lubricant so that it can't get infected. So it's important to just look for the words preservative free. It can be really helpful.
Thank you. Deborah, you had a
Yeah.
question?
Can you hear me?
Yes.
Yep.
Okay. I have corneal dystrophy, and I'll be seeing a corneal surgeon soon. But before and after my surgery, what drops would you recommend?
Yeah, so for anyone that's having any kind of front of the eye surgery, whether it's corneal surgery or cataract surgery, you will likely be on other prescription drops to help the eye heal. And so, and if you're having a corneal surgery in particular, your cornea may just be more sensitive to a lot of other things. We don't want to rock the boat any more than necessary when the eye's inflamed and trying to heal from a surgery. So definitely if you're undergoing cataract or corneal surgery, I would use the preservative-free lubricant drops. That's going to be your safest option to keep the eyes comfortable and well lubricated without having any interference on your surgery.
Thank you so much.
You're welcome. Good luck.
All right, we have time for just one more question. All right, we may be ending here. Hold on, we have one last question here. Thomas, I'm unmuting or I'm giving you permission. You just need to unmute yourself.
Thank you. Dr. Weber, in using warm compresses to release oils from the glands, is there some technique that you have to do in connection with that that'll actually release the oil?
Yeah, so I mean, it can depend. Some of this is a little bit specific to the patient, depending on where most of their blockages are. But I can just show you kind of like a little demonstration. So I have a tissue here, but let's pretend this is a washcloth or a fresh clean towel that you put under warm water. You can put it under the warm water, and obviously you're going to check to make sure it's not too hot. You can rest it over the eyelids again. As it's losing heat, it becomes less effective. So you may, if you're doing a water-based washcloth option, you may have to put it back under the warmth to get a couple minutes of warmth. You want to hold it over the closed eyelids. And once you get to 3 to 5 minutes, the most helpful way you can massage the eyelids, you want to have clean hands, but from the bottom, you want to actually push upward because the opening of the glands are where the eyelashes are located. So from the bottom, you push up, and then similarly in the opposite direction from the top, you push down. And that'll help express the oil out of the openings of the glands.
Okay, so that should be the last step after you've applied the warm compresses for
Correct.
3 to 5 minutes. Okay.
Yep.
That's
So
what I
basically,
haven't been doing, and maybe that's why it hasn't been that effective for me.
yeah, usually, I mean, the heat is the most helpful for loosening the oil. But once it's loosened, doing the little bit of massage can be helpful for getting it out.
Okay. Well, thank you very much, Dr.
You're
Weber.
welcome. Of course.
All right, Dr. Weber, thank you so much for today's presentation. This was truly outstanding.
You're welcome. I'm happy to help. And of course, you can reach out to the Prevention of Blindness Society for any other information, or I'm happy to see you in the office if there's any way I can help. Thanks, Sean.